The best new patient generator in decades is virtual reality for dental patients. Opera VR, completely transforming the patient experience, truly gives people a remarkable experience. We can completely transform the patient's awareness, transport them outside of the operatory. Go to operavr.operadds.com. Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, looking confused, is my man David Pryor.
Hey, Bryan, how's it going?
It's going well. I'm excited
About
having a fantastic guest who's going to talk about one of the biggest problems we have in the dental industry today, at least from the dentist side here, which is the chair that I'm sitting on. So
okay, let's hear it.
So we have with us Adam Reisch from Honkamp Krueger. Thank you, sir. Thanks for being on the podcast.
Yeah, thank you for having me.
Well, we were talking just now before we began about how we didn't really talk about the problem, but I can't remember the statistic of how many dentists actually can retire by like age 65, but it's abysmal. It's like 4% or something ridiculously small of dentists that can retire at 65, living the lifestyle that they want. And so and part of that has to do with retirement planning. Part of it has to do with getting the maximum valuation for your practice. And so, if you have some tips or you want to talk with dentists about how we can help them get into that 4% or whatever that statistic is. Do you know what it is? How many dentists can actually retire by age 65?
I think you're pretty close with the 4%, to be honest.
That's brutal. I mean, I look at it as somebody who as a dentist, and I go, dentists make good money, that's just abysmal. So do you have like insight into why and what we can do about it?
Yeah, I mean, it really goes back to the beginning. And in school, you learn so much about teeth and procedures and what you need to do to be a good dentist, but they never teach you that you're going to be a business owner too, and that carries with it a lot of risk, a lot of responsibility. And so you can come out and you can do great dental work, but you still got to have the business sense and the knowledge to say, okay, here's where I'm at. I'm getting out of school. I probably got a ton of student loans and debt to take care of. I might be buying into a practice soon, and that's going to bring on more debt. At some point, I might get my own building, build a building, buy a building, and that debt and that cash outflow keeps adding up. So dentists do make good money, but there's a whole mountain of things behind them, or that comes after that getting out of school with the knowledge to be a good dentist, that they're just not prepared to, how do I handle that from a financial standpoint? And by the time they get to the point of thinking about retiring, it's going, okay, I haven't done anything for the last 20 years to think about this ahead of time, and now I want to get ready to retire. And so the most important thing is to plan early. You might have a mountain of debt and you can't put a ton of money into your 401k. That's fine, but the best thing that you can do is take step number one and just get started on that. The earlier the better to think about retirement. Even day one, your first day on the job, you're not thinking about retirement, but it's got to be in there somewhere, or you're never going to get to where you need to go.
So when you say, like, we may have people listening who either are early in their career or mid stage or late stage going, so how do I get started? So what steps would you recommend that people take?
Yeah, so the one thing that most people don't do is put together a budget. And, it doesn't have to be down to, here's how much I'm going to spend on McDonald's, on a Saturday night kind of a thing, but you have to allocate the dollars that you're going to make, and a portion of that budget and some of those dollars have to be to paying yourself first and getting ready for retirement. Whether that's opening up an IRA, whether it's you're an associate at a practice that has a 401k and making sure you're contributing and getting some match coming in from an existing doc, you got to get started. Even if it's small, you got to get going. But I just read this morning that they say that most Americans need to put away 15% of their wages in order to be able to retire, and most people are putting away less than 5%. So even if you start small, you can always ratchet it up, but get going early is be the most powerful thing that you can do.
And what percentage of practice, I mean, because, I sort of have my own perception on the landscape of things, but I may be totally off. But I feel that dentists tend to overvalue their practice as a retirement. So they kind of feel like, well, I've got my practice, so when I sell that, I'm good. And then when they go to sell it, they're shocked at the valuation. Is that what you're seeing also?
Yeah, I would absolutely agree with that. When you put your heart into something for 20, 30, 40 years, you absolutely value that. And, as you should. But the reality is that when you go to sell to the next person in line, is they're going to look at it from a more unbiased opinion of here's what the cash flow looks like. Here's the money coming in. Here's the money going out. Here's the number of patients and the health of this practice. And that's what I'm going to pay you for. I don't care how long you've been doing this and how much blood, sweat, and tears are in it. I'm going to pay you based on what this practice can sustain. And a lot of times those two numbers are drastically different from somebody buying in versus somebody who's selling.
Yeah. So as you know, I just went through a transition with my practice, and I am guilty of basically absolutely everything you just said. I did plan, so I did. I did place money into a 401k and I budgeted that way, but I did not from a big picture, I would budget, but I certainly did not know how much cash was coming in, cash was going out. I knew nothing about EBITDA before I went through a transition, and I look at that and I go, I would have been much better off probably if 5 years before a transition, I had focused on changing that EBITDA, changing that profitability. And so do you work with dentists and help them kind of maximize from that perspective? And then I guess it's a two-part question. How important is maximizing that versus actually doing the retirement plan and focusing on a 401k? So
Sure.
Does that make sense?
Yeah. The nice thing about that question is they really go hand in hand, right? So you need to focus on the practice and building up the practice and bringing the money in. Then you have to understand where it goes on the expense side. And while you're doing that, you can allocate some of those expenses to that 401k. So, we talk with dentists all the time about they make, X number of dollars, and then Uncle Sam's going to come in and get his share. And one of the best things that you can do is come up with a tax deduction where you don't have to give the money to somebody else, right? If I buy a piece of equipment, I'm sending money to Patterson or to Shine, and we love those guys. They take good care of us, but I'm giving money to somebody else. Well, when I put money into a 401k or retirement plan, it's coming to me. It's just in a different pocket. It's a pocket that I'm not going to touch until after I retire. So it's kind of twofold. I generate that income, and then I find a way to keep that income from Uncle Sam by putting it into a retirement plan, which is going to benefit me down the road. So when you do all these things kind of in concert, they really work well together to accomplish a number of goals. One is like you said, you build up that cash flow. 2, you maintain cash flow because you're not paying it in taxes. 3, you're building up your retirement for when it comes time to transition. So these things can all work together, but you have to, again, have that knowledge of here's where I'm at, here's what's coming in, here's what's going out, how do I need to pay attention to this, and then how do I allocate where I put those extra dollars.
You had said, or Bryan had said one thing just a few minutes ago about planning 5 years out for moving out of the practice and selling it. And would you say that that's an accurate time frame where people should start transitioning their work habits into something different than what they've been doing traditionally, going from a growth to a sustained model and being able to get the practice queued up to be able to sell?
Yeah, that's typically a good time frame, and obviously every practice and every situation is going to be a little bit different. But if you start that 5-year mark, that gives you the chance of, do you need to accelerate it or can you accelerate it? Great. Do you need to hit the brakes and take 6, 7 years? Yes. But if you're ready in that 5-year time frame, you're thinking about an associate, and if you need to find one, you've got time to bring them in or her in and get them up to speed with the way that you do things and get them comfortable. Some dentists are in more rural areas, so it takes a little bit more to recruit, so they might have to spend more of that time frame recruiting. You certainly want to maximize what you're doing from a system standpoint. Is my technology up to date? Do I have the equipment that I need so that when somebody comes in here, they're going to pay me top dollar, as opposed to being like, well, I'll give you 40 cents on the dollar, so I'm going to have to stick a bunch of equipment into this. So you can kind of get on that plan of, all right, I'm 5 years out, here's what my equipment looks like, and those sorts of things. Are you expanding hours? Are your hours shrinking? What is a time frame that somebody else is going to want to work? Is it a one doc practice? Is it a two doc practice? Do you have multiple docs working in the practice, and how do we transition? Is there more than one doctor, or is it just one doctor joining practice that's currently working? So 5 years gives you enough flexibility to get things in place if you haven't done what you need to do. Also allows you to deal with things if say the economy tanks and things aren't going well. Well, now you're not stuck on having to sell in year 2. You can plan out for year 3, 4, 5, or you're getting to year 5 and things aren't going well. You can stretch that out. But a 5-year window gives you typically enough time to implement anything that you really need to help make the practice more saleable.
Great. I love your perspective. I love what you said. I'm going to restate it a little bit because I feel like Dave's question probably came from the same perception as most of the people who are listening, which is, okay, you're saying I should plan 5 years out, so I should stabilize things, when in fact, it's the exact opposite. Like that's where you really need to push hard, where you need to show growth. Because like Adam was saying, that might be the time that you're looking to bring in somebody else, where you want to update your technology. That's not the time to coast. And that's, I think, the prevalent thinking is well, if I'm 5 years out, I should just kind of stay the course. Absolutely not. That's when you probably should have your foot on the gas the hardest. So you really do need to plan out. And that's one of the things, if you wait too long, you're not going to have gas in the tank, right? To put it to, so that's, and I think, correct me if you think differently, Adam, but 5 years is actually a short period of time, but you really have to think, when is the 5 years going to come? It's something you really have to think about early on in your career. I think that it's commonly said that whenever you take a job, you should think of your exit. And the same thing is true as whenever you start a business, you should think of how you're going to transition out. If you're in a business, even if you want to work till as long as you possibly can, I would want to put in some type of strategy if I do need to make a transition at any time, and get yourself and your practice prepared for it. Do you agree?
I wholeheartedly agree. If you're not planning, you're never going to get to where you want to be, right? If you don't know where you're going, you'll never get there. So even though it might be a moving target, right? You might say, here's my plan, and that plan might change for, any of a host of reasons. You still start with a plan, adjust it on the fly as need be, and you go from there. But you absolutely have to have a plan, no doubt about it.
And that's could you talk a little bit about Honkamp Krueger and how you help dentists get that plan together?
Yeah, you bet. So, our philosophy is we want to be your business partner, and we kind of take a look at, things we've been talking about is that understanding that financial statement and that cash flow. And so we'll help dentists put together their monthly financial statement, help them understand what does that financial statement mean, and then we'll utilize that financial statement to put that plan in place and say, okay, here's where we're at. If you want to retire in 15 years or in 5 years or in 25 years, what are the steps that we're going to have to take in order for you to get there? And we look at that retirement plan. We look at the cash that's coming in. We look at, do we need to acquire another practice? Do we need to add another doc? Those sorts of things. So, it's one thing to have the information. It's another thing to understand that information and use that information to make some decisions. And that's where we're a little bit different, is we're going to be your business partner, hold your hand through those sorts of things and explain to you what those numbers mean, and turn that number and that explanation into a business decision that hopefully leads to a good, long, successful career and an exit when you're ready to do so on your terms.
I'm going to restate it because I think it's important, not just having a plan, but having somebody that can sort of maybe not think outside the box, but think beyond if somebody's been having a single dentist practice for 20 years and they're looking to transition, having somebody else that has walked that path several times to set the stage for that next stage, I think is very, very valuable. So thanks for doing that. And where can people go to find out more information?
Yeah, you bet. So they can always go to our website, honkampkrueger.com. Or if someone's listening and they want to get a hold of me, my email address is AREISCH@HONKAMP.com. or phone number 888-556-0123. More than happy to talk with you.
Well, hopefully together we can get that up to 5% of dentists able to retire.
Yeah,
it's brutal.
That's our goal, definitely to increase that. But, and again, dentistry is a wonderful profession. You get to do a lot of great things, work with a lot of great people, help people out. Nothing exudes more confidence than a healthy smile. So it's just a matter of helping people who are professionals at that aren't professionals in other things, and just helping them out through their journey. So.
Yep, it's not what you make, it's what you keep, right?
Absolutely, absolutely.
Well, thank you for being on the podcast. Appreciate it.
Thank you.
Okay. I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.